you think about the issues we face, we really are at a crossroads of change. What's really out there is not sustainable in terms of year-over-year increases in healthcare costs.
Hi, I'm Bruno Aziza, and today I'm sitting down with Dennis Sherry, who is a Senior Vice President in the Office of Strategy at Mercy Health Partners. Dennis, thank you very much for your time.
Thank you.
So the healthcare is going through a change, not just culturally, but also from an infrastructure standpoint. The healthcare reform is a clear catalyst for change. There's a lot of investigation of healthcare electronic records. First of all, can you tell us a little bit about the issues in this industry around strategy execution?
Certainly, I appreciate the chance to be here. I think if you think about the issues we face, we really are at a crossroads of change. One of the issues that's out there for us is the cost side of the equation. Across the country, healthcare is about 17.5% of the GNP, which is substantial. What we talk about as an industry is the question of bending the cost curve. What's really out there is not sustainable in terms of year-over-year increases in healthcare costs. So we're being challenged as an industry to do a couple things from a strategy standpoint, show that we can provide the right quality for our patients, show that we are evaluated in terms of the cost it takes to care for patients. And then really, I think another thing is to from a customer standpoint, to show customers that we really can meet their needs differently from what they've been in the past. People are very frustrated by the fragmentation in healthcare. They're frustrated about the fact that it's very hard to access and make your way through the system. They're frustrated about the fact that there's not really easy line of sight for how they can really find care needs being met and really find access to care.
And so, as it's changing the way you think about, and not only serving customers, but the way you measure performance, it seemed in the past hospitals were very focused on financial performance. How do you think about it now?
Right. I think at Mercy, we've been focused clearly about financial results. We're a not-for-profit organization, and so it's important to have enough money being generated to help us be able to put capital back in and keep your technology up to date and so forth. But that being said, that we do very much care about the industry is moving this way to really focus on quality. And we're being held up to standards around benchmarking also. Does your quality stack up with that of other hospitals or other organizations in healthcare? Does your patient satisfaction, customer satisfaction levels stack up? Is your cost per unit on par? So we do a lot of benchmarking in the industry, and I think that's magnified the need to really think about different dimensions for how you want to measure your success as an industry and as an organization.
And so the benchmark you're referring to is the Institute of Health. Now, what are the consequences of not matching the benchmark? Is this something that you impose on yourself, or is this an industry obligation?
We've historically adopted a benchmarking mindset within my company, but that being said, if you look at the future, Medicare, who's one of the biggest payers in healthcare, is going to be moving toward more of a pay-for-performance model. They've done some pilots which we participated in historically, but as you go forward with the health reform that's out there, there'll be actual penalties in terms of not paying for care if you don't meet certain benchmarks in terms of quality or satisfaction levels. So there's definitely for the healthcare industry and hospitals in particular, a need for us to be able to show that we can meet within those benchmarks.
So as you're thinking about broadening your perspective away from financial performance to other metrics such as quality or lowering the cost, what's the role of business analytics in helping you achieve these goals?
I think the healthcare is replete with a lot of data that's out there. The question, and this is where analytics come in, is how do you convert that to meaningful information to make executive decisions around that support your strategy. So from our standpoint, if I think about analytics, one of the directions we're going is to understand our customer better. So there's a whole issue around customer intimacy, really knowing your customers, knowing them longitudinally, and I think business analytics help out a lot with that. I think there's a clinical side to this also where if you think about part of our job is to help keep people healthy, not just treat them when they come to the hospital. So from an analytics standpoint, there's support for knowing customers' stages of life and what typically needs to be done as far as routine checkups and screenings, that sort of thing. Then finally, for patients who are folks that have more chronic conditions, trying to really use analytics to understand and predict, their needs for care given their current physical state and how that'll change over time. So there's a lot of different dimensions to that I think our health industry will begin to adopt and really go after in a bigger way as we move more forward in time.
And so it seems, especially for business analytics, that the complexity of audience is fairly wide. I mean, you have the patients and giving them access to their own records. You've got the doctors, and they play a role both in providing care but also deciding who goes to the hospital. You've got the whole sense of running the hospital and the operational sense of it and using analytics there. Is there a particular set of metrics that you're looking at that might be different or might be kind of an example of the future of where hospitals are going?
I think there's a couple things I'd say about that. One is definitely on the quality front. We're really trying to use analytics to understand for critical conditions, medical conditions, what are the drivers that affect recovery times and help really promote flow through the hospital. So analytics can be used to think about the stage of care at any given day in the hospital and how you can intervene and really move the patient out faster. So there's dimensions around that.
So in patient flow, this is the length of stay,
length of stay.
How do you describe that? What are the things that are involved here?
Length of stay really is a combination. When you think about flow, and actually length of stay is one of the biggest factors that reflect quality, because if you can reduce it down, it means you're getting care delivered faster, more cost effectively. You keep it within quality parameters also with that. And so I think we're looking at day by day care pathways each day, what's required to move the patient through. We're also creating protocols for different medical conditions to say, if you're this kind of medical condition for heart conditions, this is what you can expect. If you're a respiratory case or perhaps a neurologic case, this is what you can expect too. So we're using analytics to help understand and model what's the best and more optimal pathway for flow through the hospital. And it's really geared toward assuring high quality plus really reducing costs and really, from a patient standpoint, being more convenient. They're not in the hospital really 6-7 days. They're in there 1 or 2 or 3 days at most.
So there are two things that I'm hearing here. I mean, the example of the length of stay is a great way of thinking about how quality relates to cost and relates to margin and the ability to make money and operate with a great sense of profit. But there's also this idea of understanding the drivers to the length of stay.
Correct.
That if you understand the logic there, you can improve that metric over time. Have you found that in the area of culture? I mean, we think about the medical world as something that is an area where people learn by experience over time and so forth. So, how are people working with analytics? I mean, thinking doctors, nurses, people operating hospitals. Is that helping, or?
I think from a cultural standpoint, the nice thing about healthcare, a lot of the workers are highly trained, highly educated. You take your doctors and nursing staff in particular, and they really are. Their training is really geared toward looking at data, understanding what the implications of that data would be to the treatment course they want to recommend or provide for patients, and they really react to that as well. So the great thing about analytics is if you can get real-time information to the doctors and staff, they will use that and make the right decision, especially when it's compared to benchmarks as well, because they want to perform well. But they want to do the right thing. They want good outcomes for the patients, and so so the nice thing is that they're wired to want to do the right thing. They're wired to want to provide the best quality care, and the analytics help show them what can I do to improve the quality care I provide.
And so for the nurses and the doctors, clearly, what we're not talking about here is providing a lot of information or complex applications at them. It's providing the right metrics real time so they can act on them because they're geared towards the job. And the patients themselves, I guess they're geared towards convenience and having access to their own electronic records. Or how do you think about that?
I think from a patient standpoint, that's an area that's really I think the industry's been behind on, but more and more there's really a demand and expectation of what I get in other industries I should get in healthcare. So if I want 24-hour banking or availability to make my reservation on an airline flight, I want the same thing in healthcare. I want to be able to go ahead and schedule at 11 o'clock at night my doctor appointment. I want to be able to look at my medical record information. I want to know what I was supposed to do as a discharge follow-up once I left the hospital for care, or I want to also be able to look at my bills financially and understand those better as well. So I think we're going to see a big expansion in the kind of capabilities that will be available to patients in the near future, and things like having them available on mobile phones and other media, your computers at home, that sort of thing.
It seems that for other industries in healthcare, we've got great lessons here in terms of using industry benchmark, really the industry pushing you to measure up against the benchmarks, otherwise you're not getting paid. And also the healthcare is learning from other domains and other industries by being able to understand the customer intimacy campaigns and things like that. One last thought maybe is your approach to risk. How do you think about that, and how do you use analytics to prevent risk or treat patient better?
We actually spend a fair amount of time looking at quality data to look at that, and we also have systems in place that really, if patients, or excuse me, if staff are concerned that there's something that's not being done right within a hospital, they can actually have the option to call hotlines for risk. So risk is a big deal for us, and we do have people dedicated to looking at that. The other thing from a quality standpoint is that if you have an outcome that was not optimal, there's a lot of work done by staff to dissect what happened, what went wrong, what can we learn from that, and improve that as well. But risk is definitely a big thing in healthcare, both from a standpoint of just improving care and quality, but also avoiding downstream malpractice litigation.
That's great. So lots of opportunity here with data in healthcare, obviously understanding the customer, providing information to those patients so it's more convenient. You've got higher level of quality, preventing conditions so you, again, raise the quality. Dennis, thank you very much for your time.
A pleasure. Glad to be here.
Until next time, I'm Bruno Aziza.